Well, that's right. This new lawsuit by the state attorney general targets the nation's three largest insulin manufacturers, which produce 90% of the global insulin supply. Here in the U.S., though, insulin costs 10 times the price of other countries.
Many of my colleagues or peers have to go to Mexico or Canada to get much more affordable insulin. That's just not a functioning healthcare system.
Southern Californian Chris Noble has been living with type 1 diabetes for nearly 3 decades. He says in 1995, a vial of life-saving insulin cost $25, which as a young boy would last him a month.
Now that exact same vial of insulin is well over $300.
Now as an adult, that vial lasts him less than 2 weeks.
Every 2 weeks, I have to pay my living rent of $300+ for this life-saving medicine.
Noble, who works as organizing director of Health Access California, the state's health advocacy coalition, is fortunate that he has insurance. For hundreds of thousands of diabetic Californians dependent on insulin to survive, that is not the case.
We're going to level the playing field, and we're going to make this life-saving drug more affordable.
California's state attorney general is now suing the nation's top insulin manufacturers, along with big pharmacy benefit managers, accusing them of illegally inflating the price of insulin, aiming through the suit to lower the drug's cost and also get restitution for patients who have overpaid for insulin for decades.
And who suffers the most from these unscrupulous business practices? People from low-income households, communities of color, working families struggling to make ends meet.
Many of the companies named in the suit counter that the consumer price of insulin is already declining, an Eli Lilly spokesperson calling the lawsuit's accusations false allegations. California is also investing $100 million into a plan to manufacture its own supply of insulin and sell it at a much cheaper price. And it's not exactly clear when that insulin production by the state will begin. However, on a nationwide level, the cost of insulin is now capped at $35 a month for seniors 65 and over who are on Medicare.